Basic McConnell taping for the knee. McConnell taping for the knee is used primarily for anterior or pain in the front of the knee. This is generally caused by a weakness or a lack of endurance of the muscles on the medial side of the knee. This results in the kneecap or patella sliding to the outside a little bit, and that causes increased friction of the kneecap and the knee joint. This then leads to pain in the front of the knee. What we generally use for taping here, I use a cover roll initially first. This is a 2-inch tape that we put on under the actual tape that's doing the job. And that tape on the top is a 1.5-inch tape. We use Leuco tape because it really stays on really well. Now on to the actual tape job. First thing we want to do is make sure that the muscles in the thigh are relaxed. If they're tight, then the kneecap's going to pull up and we're not going to actually apply the tape to the correct area. I've placed a few lines around here so we can orient ourselves to where we're placing the tape. First line, or first 2 lines, we're going to find basically the top of the kneecap up here, the bottom of the kneecap, and we want to find the edges or the sides of the kneecap. I have a line here for the lateral side, a line on the inside for the medial side. A couple other important landmarks to remember. Want to find this sort of bony prominence on the inside of the knee. This is sort of where our tape's going to anchor at. And I've also drawn a line more to the inside here, which is where the tendons for the hamstrings are sort of inserting into the lower leg here. This is important because we do not want to take the tape this far. So this is basically our limit of where we can bring the tape to. Now actually applying the tape. We don't usually need to have these lines on it if we're actually applying the tape, but I'm just putting them on here just for illustration. First thing we want to do is get the cover roll. We want to place this so that it's inside these lines here for the top and bottom. We want to take it from just outside, a little bit outside, and maybe an inch of where this lateral line is for the kneecap. And take it all the way down, again a little past this line for the bony prominence here. Bring it down, and we're going to cut the tape there. And peel it. Be a little careful here, you don't want the tape to stick to itself. Again, we're going to start a little bit before, or a little bit lateral to this line here. Get the tape down and bring it over top, down just past this line down here. And you want to smooth the tape down, make sure it's sticking on good. One little note, normally we would shave the knee. I'm not shaving my knee just because I don't need the tape job right now, but that's what we'd normally do. Saves getting hairs pulled out and everything. Next thing we can get is the actual Leuco tape, which we're going to put on top of this. Start the tape here. Last time it got a little bit of a ragged edge, so I'm going to straighten that out. Where we're going to start this tape again, if we draw a line here for the lateral side of the kneecap. I'm going to start a little bit further out than that. Not all the way down to the edge of the cover roll, but just a little bit out. So I get that down, secure it, right there. I want to get that secured fairly well there first. I'm going to bring out some of this tape. This is pretty sticky tape, so it's a little hard to pull out. And from here, what we're going to do is we're going to glide the kneecap to the inside and hold it there. Push as far as you can to the inside. Then we're going to pull this tape across. Keep it taut here. Bring it down just around that level of that bony prominence. And what you'll see here is that we have some folds under the tape here. So keep that secure. Just press down on it, make sure it's sticking good. What we want to do is sort of spread out these folds. You don't want one large fold in here. It causes too much friction. So we want to make a lot of little folds here. And we're going to press down on the tape so we warm it up a little bit. It helps it stick real well. And I'm going to bend the knee, make sure it's staying on pretty good. And what you'll feel when you're bending the knee up is that the tape tightens here. And that's basic McConnell taping. That's it for basic McConnell taping for front of the knee or anterior knee pain. A couple things to note though is that you want to make sure the area is clean and dry. If you have to wash your knee and dry it off before applying the tape, that's actually a very good idea. Any oils or other things on the skin will stop it from sticking. An additional thing is if it's still not sticking or staying on throughout a run is we can use a skin prep on the area, place it down. It's got a foam applicator and it's liquid, and this will really help it stick really, really well. The one we used here is by Coloplast. One thing to note with it though is that since it does make it stick better, it's also harder to get off. Usually if you're using it in hot weather, by the end of a run or something, it's not really any different at the end taking it off than any other time. But if it's really sticking and you're worried about it pulling skin along with it, which none of us want, it's good to have something like acetone or some other solvent that's safe for the skin to loosen that adhesive. Well, that's it for McConnell taping for the knee. Keep moving and stay healthy. Thank you.